So the moving on to number 7, they were saying they want to provide a tax credit for customer and employee wellness investments. So the premise for this is that restaurants are making significant capital investments in ensuring the safety of employees and guests. And that includes contactless payment services, modification of physical facilities to accommodate continued social distancing, enhanced sanitization, employee education and training, and the expanded use of personal protective equipment. There's that PPE again. Along with disposable products. So they would like to see that the relief is designed as a refundable tax credit to help restaurants shoulder these costs, bolster public confidence, and most importantly, ensure the well-being and safety of employees and customers. You and I touched a little bit on our last episode, or maybe it might actually have been after we had our conversation, but we did have a conversation about what happens with the restaurant that actually has to do more than just put up a few plastic shields, like you were talking about wholesale. Reconfiguration and remodeling and coming up with some kind of a concept that's going to work more than a slapped together, plexiglass shield between people that will allow you to open short term. So we've got short-term solutions that were band-aided. Now we need long-term solutions that are going to adapt to the reality of what COVID is. And regardless of whether there is or is not a vaccine available, that's not going to be at least for a year. I mean, when you talk about approvals and then disbursement, getting it out into the population and then that build of immunity, that's a long way off. So between now and then, how you deal with that is a sort of I would assume that's a capital cost. You're having to make fundamental changes to your physical environment, so capital cost. And then again, a lot of it has to do with the psyche of both the people who work there and the people who will come there. What will they tolerate next? So almost for a restaurant owner, it seems to me, and you and I have both been involved on startups, when you start a restaurant, if you have a concept and you put it together and it's based on what the market landscape looks like at the time. So we now have a shift, not a choice of the restaurant, but there's a shift. The new parameters will be very different. So people may not normally want to sit close to one another. They may not normally want to be stuck in a small little banquet room. They may not normally want to have all sorts of things that they were experiencing and liked, like share tables. I don't know if I want to sit at a share table with people I don't know. So that was like the really hot thing a few years ago, and now not so much. So with those items in mind, even a restaurant that was able to sort of slapdash everything together to get open, moving forward, we all need to sort of think about, okay, what is it going to take for us to make it feel like, look like a good experience, a worthwhile experience, a value experience, a brand experience moving forward that meets the landscape at this time, not the one that we had, which is kind of where I feel like everything keeps going. It's like, okay, let's just make it feel like it was, and it's not ever going to be like it was. So moving to that, does this tax credit for customer employee wellness investments, do you feel it goes far enough? Does it address broadly enough those kinds of concept changes and then build outs?
A tax credit, okay, if you're going to have to renovate your restaurant or you're going to have to put all this in, you got to put money out now. A tax credit maybe will come later against taxes due. Well, that doesn't put money in your pocket right now, and it will, if you have taxes that you can get a tax credit against, that's one thing. If you're in a losing kind of situation and you don't have any taxes due, then I guess you just keep having these credits build up. I'm not quite sure how that would work. But, if you're doing all of this investment, you need the money now to do it. To me, tax credits doesn't benefit the majority of the small businesses that I think are out there. It may benefit some of the larger businesses if they are profitable, if they do have taxes due and that sort of thing, and they have the cash reserves to do all of the work that they need to do, or have access to loans that they can get elsewhere to get the money to do the renovations that they need to do. I think for the majority of the smaller people, tax credits don't really mean a whole lot because again, it's something that happens in the future, maybe. And I'm not sure how much you would actually see cash. So you're having to make a decision to do all of these improvements now at X cost when you have no idea what kind of credit you're going to get at the end of the day. So to me, you almost have to deal with it like it doesn't exist because you really don't know what you're going to get yet. It doesn't really give much of a criteria for how they calculate it. So they don't say if it's a dollar for dollar or if it's a certain percentage or how it has to, how they calculate the tax credit. So I think this again may benefit some of the larger restaurant groups that could take advantage of it from a tax planning perspective. But I would think most of the smaller businesses probably not so much.
Other thing that isn't as necessarily helpful as we had hoped it would be. Number 8 is they started digging down a little bit into business interruption claims for impacted small businesses. So the background on this is that to ensure that the market for the pandemic insurance remains available and affordable to businesses in the United States, the association supports the passage of a federal backstop for pandemic insurance. Before COVID-19 pandemic, some commercial insurance policies contained exceptions for business interruption or other losses due to a pandemic. And I want to clarify in here, and I will put some information about this in as well, but there was only one pandemic insurance on the market before this all started. And it was started in 2018 by a company in San Francisco along with Marsh, big insurer Marsh. And that pandemic insurance never had a single customer. So people were relying on some form of BOP or business interruption insurance to possibly cover this. But my guess is probably most people never even gave it a thought. I'm probably guessing 90% of most of the restaurant owners out there didn't even know that it was or wasn't covered. It wasn't like top of mind, so they're not going to look for it. They were saying, in terms of the NRA, they were saying the refusal of coverage by insurers has proven devastating for some businesses and their employees. Without federal support, pandemic insurance will be very expensive and difficult to find, putting it out of reach for most businesses. Now, one of the things that I did read, and I wanted to get a little bit more of your feedback on this, is that, again, because there was COVID first, and then there were some losses, and then there was civil social unrest, which caused further additional losses impacting a business. The policies that did actually have some coverage for pandemic or biohazard, et cetera, it's based on losses, like an actual table of losses, and your losses are not now 100% COVID related. They're part this, part that. So there's going to be this real difficult issue about how to hash out which coverage is going to cover certain kinds of things, because there was like loss of income due to almost like domestic terrorism. We come very close, if somebody actually were to say domestic terrorism, that opens up a whole other can of worms. So we were perilously close to that and triggering those in some of the insurance policies, but I don't think they ever went that far. So we still have to take it into account. So we've got two issues kind of bumping into each other. And to me, that smells like just a lot of lawsuits. I mean, like lawsuits that insurance companies and the government can fight, but not necessarily a small business owner. I mean, you just don't have the pocket to be able to go in and fight for that coverage if you were entitled to it.
And also there's limits on all of these, right? So when you have your insurance, you have limits on the different types of coverages. So business interruption may have been limited to $100,000 or $250,000 or whatever it is that's in your policy. So it's not like it covers everything. It would cover it up to that limit if you can prove that you had a loss of income, which most people could prove that. I would think if you have both pandemic coverage and business interruption, I am sure that they probably both had limits on them. And what you would do is to submit the claims and they would sort out which falls into which bucket. And my guess is you're going to have enough of a loss to hit the limits on both of those, because they're not like multi-million-dollar limits, I wouldn't think.
Right.
Unless you're just a really big company. A small, a regular small business package, it has a certain limitation and it's not huge. It helps somewhat, but it's not like unlimited. On the the business interruption, with the demonstrations and the rioting and that sort of thing, part of what I'm hearing is that business interruption, again, wasn't meant to cover vandalism every night. I mean, it was an event like an earthquake or a hurricane or whatever, but it wasn't meant that you had 30 days of rioting every night and your store got damaged repeatedly over a period of time. So that was also one of the things that was causing some grief for people, because their insurance would only cover so much. They can't cover every single damage that happens all for this length of time. And the same thing with the pandemic. I mean, look how long this pandemic is going on. So my guess is if we do get any kind of pandemic coverage in the future, it's going to be real interesting to see the time frame it can cover and what the limits are, because it's just, the losses could just be enormous. And I'm not sure how anybody would cover that other than kind of like this federal program, like the flood insurances, like flood insurance in places like New Orleans. You have flood insurance, which is a federal program, and everybody has flood insurance, and the premiums are pretty reasonable. There are limits as to what it covers, but because no insurance company wants to cover all of that themselves, they have the federal program that helps cover it. Right. I'm assuming they want something similar to that for this pandemic, and they would just, I presume you would pay every year for it, and that kind of is what builds up the fund so that they have something to pay it out. And, I looked into that right away when this happened. It's like, oh, surely it will cover business interruption because we can't be in business. But it specifically calls for physical damage. Your business has to have physical damage, meaning it falls down, burns, whatever it may be, to qualify for business interruption. So something like a pandemic. And then when I looked further, sure enough, in the policy, it says, this does not cover any kind of pandemic. And people don't normally look for that because we haven't had one, right? That went this kind of detail. So, you don't notice it until you go to look for it. And then you realize it's not there. I don't know what they're going to do. I know there've been a lot of push to make the business interruption cover it, but I think it's going to be very difficult for them to win on that kind of a situation, just because it's just really not meant for that kind of coverage. Now that we know it can happen, something like a low cost flood insurance type thing would work the same way for a pandemic, so that you can have a fund building up that can help offset some costs for people.
Right. Well, I could see the government doing something like the NFIP program, which is the National Flood Insurance National Flood Insurance Program. With NFIP, it's a CAT program, and some earthquake coverage is somewhat covered by a catastrophic type insurance policy. So this would actually be something that would be national in scope, because it's not just people in a floodplain, for example, right, or people in an earthquake zone. Being able to spread it out over the entire country financially for an insurance market makes a lot more sense almost than to have it be covered in a business interruption policy, which is impossible to figure out. It's just like nobody's going to be happy with that coverage. No, I'm sorry, but there's just no way any business is going to be happy with the business interruption part that covers pandemics. If it were to be offered, it will have too many, there'll be too many restrictions, et cetera. But if the government does it and it's wholesale and it's ginormous, because, realistically, they're the ones who make the call about whether you do or don't get to open your business. The insurance company doesn't make that decision. So I think, let's put the responsibility for collecting it taking care of it, administering it, although I hate government programs, but they are basically the ones who tell you what you can and cannot do. So therefore, that's sort of where the rubber hits the road, I think, in terms of how this would come
Yeah,
together. So, well, it's
absolutely. If they tell you you can't open, then there
you
should
can't
be
open.
some sort of program that would compensate you if they tell you you can't open. And I know just like our governor here, you know, there've been lawsuits with the governor trying to say she's overstepped her boundaries and, you know, that's not, you know, she doesn't have the authority to say that we can't open. And the Supreme Courts have said, oh, you know, here in the state have said, oh no, that's perfectly up to her to do. And if she has that kind of power to do it, then yeah, you know, somebody needs to compensate the businesses for being told that they can't operate like they normally would operate.
We're getting into a big fight in California now. I was reading on this last night, actually. Governor Newsom has not approved Disneyland in Los Angeles to reopen. And so there are multiple, there's not that many, but there are multiple theme parks in Southern California, and they have been begging the government, or the governor and the government, the state of California government, to give them guidelines so that they can start to reopen. And they had gone through, I mean, they've been start, stop all summer. And with Disney, it was every week. It was like they're opening in June. They'll be open for Father's Day. They'll be on July 1. They'll be open on July 7th. And it's been like literally 1 week, 1 week at a time. And finally, they sent another pretty pretty straightforward letter, but still, you know, kissing ass, basically, just saying, please let us open. Please give us some guidelines. And crickets. I mean, absolutely nothing coming from the governor's office about how to open and when they can reopen. And they have done everything. I mean, they've already done it in Disney World, so it's not like they don't know how to do it. So they were showing, like in Disneyland Park, they had, you know, the strips that say, you know, stand here, and then 6 feet away, stand here, and they're ready to roll, and they just haven't gotten any kind of cooperation at all. So it'll be interesting to see how that moves forward. And you know, that's like a huge, I think it was 28,000 employees are impacted by this still being shut down.
Oh, they just laid them off. Yeah, it was in the paper today that Disney laid off 28,000 people. Yeah.
That's a lot of people down in Orange County area that don't have a job right now. So and they've been waiting patiently. But again, the government had control over the whole thing. So the insurance, like, well, how does that impact? And I'm sure that Disney has business interruption insurance, and their losses are probably bigger than the smallest restaurant. At some point, they're going to cry uncle as well. I mean, it's, you know, it's according to however much you make, you're still going to have some pain, and you may have bigger pain because you're a bigger entity. Your bills get bigger, so do your headaches. So the ninth item that they had on this was liability protection for American businesses, and we did touch on this very briefly in our last conversation. Restaurants are incredibly regulated. They were talking about how do you now deal with the nuisance lawsuits and the other things that could become part of the landscape moving forward. They were talking about the vulnerabilities from fraudulent and frivolous lawsuits over the past. And now you've got financial risk of being dragged into court so that you can't afford to operate anyway. So it has to divert resources, and you don't necessarily have to budget for this. And now you're going to budget for this as almost like a line item. So liability protection, what would make sense? Because I think, I don't think anybody in the restaurant industry is willfully disregarding the health of their own workers and that of their guests. So what would allay the problem so that it doesn't become a problem, I guess would be the best way to put it.
I do think it's a real issue because, and again, it depends on the various states and how litigious those states are and how easy it is for people to file lawsuits in those states. But I do think restaurants traditionally have had a horrible problem with people filing lawsuits. They come in and pretend to slip and fall, or, oh, I got bad food, or whatever, and you can go through and find nothing wrong, and they'll go to the hospital and run up all of these costs, and you end up having to pay for it. So restaurants are pretty much a target anyway for lawsuits at all kinds of levels. Some are legitimate and some are probably not legitimate. But this just sort of compounds the problem, because if they went to your restaurant and got sick, with all of the press that's out there right now about how everybody gets sick at the restaurants, you know, that's the prime place you're going to get COVID is at a restaurant, then it sort of feeds right into this whole frenzy of lawsuits. And they have to have some sort of protection, because there's no way you can defend yourself. I mean, how do you defend yourself from somebody saying they got sick at your restaurant? You know, if you had, and then I think, did I just see something recently about, I think it was in California, where they were talking about if you had, they considered how many people were sick at your place would be considered an outbreak. And you had to close everything down or have everybody tested. I forget which it was. But if you had more than X number of people who had COVID among your staff, that's considered an outbreak. And then there was some ramification to all of that. Right. Well, that would feed right into this kind of a situation. So if I got sick and all of a sudden it came out in the paper that that restaurant had an outbreak, then all of a sudden, you know, sure enough, you're going to get sued for something. So I don't really know how they're going to get around all of this, other than saying that you can't sue somebody if you get sick. You know, if you follow the guidelines, if you have the certification that the county, I think in California, the county has to approve your procedures and how you keep everybody safe. And if you're following it and you can show that you were wearing your mask, you were doing all the checklists that you're supposed to do, that you can be protected from a lawsuit. I'm sure the attorneys will figure out a way around that, some kind of way, and still figure out how to sue you. But I think it is going to be a big problem for restaurants. I really do, because again, in some places are more litigious, and also people are really touchy. So if, for instance, they see somebody in the restaurant who didn't have their mask on right, or who touched something that they shouldn't supposed to touch, or they didn't clean something immediately like they were supposed to clean it. You know, we went into a store the other day and the hand sanitizer was empty. And it says, well, so what good does a hand sanitizer do when it's empty? You know, so again, you know, all these kinds of things can feed into the fact that you didn't do what you were supposed to do. And so therefore you got sick. So I think it's just going to be a little bit of a hotbed of activity for attorneys and for people to claim that they got sick at places when they really, I don't know how you defend yourself against something like that.
I think it would be really difficult. And one of the things, again, working with restaurants, a lot of them have invested in some pretty high-end surveillance type. And sadly, we're kind of going down the line now where I can see where that's going to come into play. It's like, okay, well, show me proof that you did X, Y, and Z. And one of the things that I do need to do and have not yet done is I will look up to find out whether or not we've had lawsuits filed as yet, because again, we're 7 months into this process. Is anybody filing lawsuits based on patronizing a restaurant and saying, this is where I got it? And I don't know what the answer is to that, so I'll take a look. And if I find something, I will stick it into the background on this. But
yeah, I haven't heard anything specifically yet either. But you know, you just sort of are waiting for it to happen. And I think as they open more, it's probably more likely, because more people will be going, and you know, there's just going to be more activity as it goes along. Right. But you know, you can't control people 100% of the time, and you don't know where they've been, what they've done. The tracking I don't know how good the tracking is on any of the stuff, you know. I saw a couple of places that started to do it, but then, you know, how do you track anything like, I mean, I'm not sure how effective it would be, for one thing, in some cases. Now, if you were in an office and you have everybody in the office and everybody who came in and out of that office, fine. You know, that's sort of a contained. In a restaurant or any kind of a retail environment, going into stores and stuff like that, I mean, they don't, it's impossible. You can't get everybody's information and then go back and find what time they were there and when was somebody sick and go back. And by that time, it's too late anyway, right? I mean, you know, you're talking a few weeks down the road. So I don't understand how the contact tracing works. I do know that I saw something in the paper about contact tracing, and restaurants were the worst for contact tracing, and I can understand that. You know, somebody's coming in to pick up a takeout. You know, you don't want to sit there and fill out all the paperwork. So certain businesses were a whole lot better at it than restaurants. And I think as the restaurants started to do it, they realized that it was kind of impossible to do. I signed in once or twice, I think I had to sign in. But other than that, you know, I haven't been asked to do any of that since then. So
Interesting. Well, I know at the just in the past, not related to COVID, but generally speaking, when somebody, for example, shows up with measles, measles is highly contagious, and you'll get these measles outbreak alerts. And I remember it's like, you know, you'll be online reading something like in the San Francisco Chronicle, and it'll say, oh, somebody got off a plane and they turned out they had measles and they presented at, you know, such and such a hospital, and then they try and contact trace that person, and they start going through the whole thing about where they've been, where they ate, what hotel or where were they staying, and oh, they jumped on board and they rode a cable car, and you're like, oh my God, at that point you you have no idea whether you were with this person or not. I mean, you know, and I can understand like the person sitting next to them on the plane, you know, like within 6 feet on the plane, you can get that figured out. But they've lost them as soon as they go to a restaurant or a grocery store or get onto public transportation or stay in a hotel. Forget it. I mean, it's just not realistic. Although I do know one of the issues, just from a totally different perspective, on the contact tracing, I know that both Google, Android, and Apple were all talking about, you know, like how you can do contact tracing using your phone. So once somebody figures out how to access that data, and they are inviting you to download this onto your phone now, and I'm like, all right, my phone already spies on me as it is, but I don't need one more program that does that. But it would follow you like wherever you go, and I mean it follows. I mean my phone follows me into the grocery store now and knows how long I've been there and which aisles I've walked through. So it's you can't get away from the fact that somebody knows where you are pretty much 24/7 anyway. But if they really needed to get in touch with you, they could. But again, I think this gets back to some of the numbers that we're dealing with. You know, when you talk about the overall number of cases and morbidity rates are all that, it's not as desperate as it was 6 months ago. I mean, we found, you know, 7 months has given us hindsight. You know, people are not dropping dead on the street. You know, we've had deaths, and that's tragic, but it's not been anywhere near what the original concern was, which is good. But moving forward, it's sort of like, okay, let's ratchet down the panic a little bit and deal with this as a realistic. It's like, we're gonna have to deal with it, but do we need to deal with it the way that we've been dealing with it? Probably not. There's probably a better way to do it. And if we can just step back and look at it as a manageable problem instead of a reactive, where, I mean, everybody's reacting to it all the time. There's been no proactivity really yet. So I'm hoping that we'll have perspective and proactivity at some point on the whole issue.
I think too that, you know, they're learning over time how to best treat it too. So it becomes a little bit different kind of scenarios because they're learning more every day, you know, on what treatments work the best, what you need to do, and how much you need to isolate people and all of that sort of thing. So I think it's a matter of time before they get a little bit more comfort level on everything. And then if they get the vaccine out, that will help, to at least, of course, you get your flu vaccine and you still get the flu. So, it's not 100%, but at least it makes people feel better that they have done something proactively to try to minimize how badly it can affect them, especially if they're compromised in some way or another. But yeah, short of embedding us with chips like we do our pets, I don't think there's a way of really keeping track of everybody and what they do. And, it's almost impossible.
Well, what they say, a
But
little anonymity is a good thing. So I
yeah.
just go with the crowd. It's kind of
I
a
don't
fun thing.
always take my phone with me, I leave my phone there or I turn it off.
Exactly. I mean, there are times it's just kind of nice to be alone with yourself, with your own thoughts by yourself and not be on the grid. And it's just kind of nice every once in a while unplugged from the grid. The one of the last couple of items that were covered in the NRAs was prioritization of access to COVID-19 testing and vaccine distribution for the food and agriculture supply chain. So we did touch on this a little bit last time. The supply chain was fairly seriously interrupted during the early couple of months of this. And one of the things that they're recognizing, obviously, is that the food supply chain is critical infrastructure. But now that we, again, have some, I guess you'd call it distance between where we were and where we are, they're looking at ensuring that the system continue to operate safely. They want to recommend that as more testing becomes available and a vaccine is developed, that the administration prioritize food and agricultural supply chain, including restaurants, after the nation's healthcare workers as first responders and high-risk individuals. So they're looking to do additional or more adequate testing, timely test results, protective equipment, vaccines, et cetera, to maintain safe and secure supply chains from farm to tables. So in that context, did you have thoughts about how they are planning on moving that forward?
I do know that they're coming up with better and better tests all the time that are faster tests. Um, I do have a client in that arena, and one of the, if they can do testing quickly, which is what it's all moving to, that you can get a test in an hour and get your results back. Part of the problem right now is that it takes forever to get the test back, right? So you
Right.
take your test and then a week later or so you may get a result, or a few days later you may get a result. Some people it's 2 weeks before they get a result. Well, by that time you're sick and you're already either getting better or you've infected everybody else in the world. So the lag time is really bad. But I think as these tests are becoming better and better, and they do have tests that have results in an hour, that you can get a test result back in an hour. And that kind of brings it down to where you can do a lot better testing in places like restaurants or whatever. It would be a whole lot easier to test your people every week, where you could actually do a test, and the cost is coming down. So, the cost for a restaurant to pay for a test for everybody in their restaurant, all the workers, once every 2 weeks or once a week or whatever, could be very affordable with the kind of tests that are coming out now. And that would sort of ensure, and it would also help with the lawsuit thing, but it would also ensure that, people are being tested on a routine basis so that you're not infecting anybody else. It would be hard to do it with your patrons, but, as far as the people doing it. And I think the same thing as you go back into a lot of the food chain, the packing houses, the distribution, all of that stuff. As these tests become more affordable, it's a whole lot better. Just like, when they're doing the locations, shooting for movies and stuff like that, they test people every week or so. They test the people going on and off the rigs that go for oil rig drilling, They test them when they go out, they test them when they come back, you know, so all of that is happening in a more real-time way so that they can help eliminate some of the spread that was happening because of the lag time in when you had the test and when you got the results back. So I think if they keep getting the tests better and they have it affordable to where companies can do it as a preventative, it probably is a whole lot cheaper for them to do it on a preventative basis than to deal with it when they have to shut down, because now they have to do all the deep cleaning and all of the other costs to get their place cleaned up. You know, compare that to what it costs for you to do the test for people. And my guess is the test would be a whole lot cheaper. So I think as all of that improves, that will definitely help, because look at with the meat prices kind of went crazy for a while because of the packing plants had outbreaks and stuff like that. So I think as they get their procedures in better order and we get the test and everything in better order, it will make it a whole lot easier for people to feel comfortable that their food supply has not been contaminated. But look at how often we get E. coli, you know, and stuff like that. You know, it's stuff gets on food stuff, you know, it just sort of happens. And I think you probably see a lot more infection through E. coli than you do from COVID when it comes to food supply. But, you know, the more they can do, the more comfortable they can make people. And if they make people comfortable, then they'll start going to restaurants again and feel comfortable with their food supply, and also with the people who are serving them and taking care of them, and at both the you know, anybody who is dealing with the public a lot, be it restaurants or hotels or anybody else, you know, the more that you can be sure that the people you have working for you aren't sick, the better it'll be for everybody. And people will feel more comfortable and we can sort of get back to a more reasonable lifestyle.
I think we definitely were blessed by the fact that it turned out not to be a surface contaminant in terms of like food surface. If it had been an E. coli salmonella type issue where it was in the food, I mean, when this whole first thing started, I actually, my first thing was, okay, I'm not going to use salad out of a bag right now, you know, just because, I mean, it's like, if it turns out that we didn't know at that point how it was transmitted the first week, you know, I thought, okay, if I have to have my emergency food backup, I'm not going to have the kinds of things that have been touched a lot by a lot of people, because we don't know whether it's surfaces, contaminant from, you know, breathing or surface or touching or whatever it was. So it makes sense, you know, and then moving forward, I think since we know, I think we're fairly certain at this point that COVID is not transmitted in your food, at least not from at the harvest point. But we did see, as you mentioned, terrible outbreaks in meat packing and some of the chicken facilities across the country, and that put a huge crimp in the supply chain. So I noticed that one of the things that they were talking about is they're talking about making sure that food and agricultural workers, so that totally makes sense, is that the workers themselves are prioritized like we prioritize healthcare workers and first responders, so that they are, you know, the first to receive vaccines when they come out and the first to get tests when the tests get better, et cetera, so that we know for sure that those people can stay on the job and or are not contaminating the things that we're consuming in any quantity. So that's a good thing. But I did notice, and I was happy to see this, is that the NRA is also saying they're supporting other initiatives that will help the federal government test for other issues moving forward. So in other words, this is not an isolated incident. I mean, we all know it's not. And maybe if it was higher up on the dialogue list of things that people are concerned about, it would get more attention and therefore more support and therefore more funding, so that they are paying attention and making sure that that food supply stays safe. And the only thing I can think back to is that's somewhat similar is back in the early days after 9/11, there were big concerns over the food supply. Tax relief for essential infrastructure workers, including people who work in the restaurant industry, in the form of a suspension of federal income and payroll taxes for wages earned by food and agriculture workers, and including restaurant workers, is essential. So they're saying that they would like to support essential workers as they serve the nation during the difficult time and incentivize their continued commitment to keep working and keeping Americans fed. My question was this: they were now putting them on the same level with first responders, which also would include, you know, like fire, medical, etc. Do we now have like this whole emerging group of people who get payroll tax relief? And we now, like, we've moved restaurants into that category as well. And were they planning on giving this to those other workers that are not necessarily written out here? Because they noted food and agriculture workers and restaurant workers, but they don't talk about actual real first responders. So is there other movement to give them payroll tax relief, like if you work at a hospital, or if you're an EMT, or if you're somebody working in the medical industry, et cetera? Or is this just a one-off?
I think it's going to be difficult to kind of pick and choose which workers get tax relief and which don't. I think that would be highly contentious, because as it is, there's a lot of bad feelings about who is considered an essential worker. I know here there was a lot of discussion as to how does the government say my job is not essential and somebody else's job is essential, when I'm doing a service that may be providing the stuff that these people work with. I'm not essential, but they are. You know what I'm saying? So the manufacturers who make all of the PPE equipment and everything, they're essential workers, but they don't fall in the same bucket as other essential workers do. So I think it's going to be kind of contentious to do this. And with these kind of programs, when you start, where do you stop? You know, so once people get used to not having payroll taxes taken out and they have to go back on to having payroll taxes taken out, that becomes a really big issue. So I'm not sure how much of this would really fly in also with the fact that our deficits are so huge that, you know, with all of the different relief that they're giving people and giving businesses, and they're not collecting taxes coming back in, that's only going to make the situation worse from the government level, you know, with deficits and everything else, which then can drive up income taxes and everything else. So I don't know. I think this is kind of like, it would be nice if it happened, but I don't see how they can pull out one little group of people and say, you don't have to pay payroll taxes and everybody else does. I think that would be really difficult. And I would think that there would be a lot of lawsuits filed saying that there is discrimination between this kind of worker and that kind of worker.
I'm hoping, like you, I think that cooler heads hopefully will prevail. But at this moment, it's the Christmas tree that is covered with ornaments. I mean, it's like everybody's throwing everything at it, and it's getting very heavy with ornaments. And it doesn't, in a lot of times, make sense to do what they want to do. I mean, I understand that, you know, it's like, we'll throw spaghetti against the wall and see what sticks. But it's an awful lot of spaghetti, and unfortunately, a lot of it will stick. And so I'm not really sure how always helpful it is. I mean, there are other things that might be more meaningful for greater numbers of people, and like you said, contentious issue and litigious at the same time. So don't want to go there. And one of the last, I think it's the very last point, this was getting into restaurants, and as you were talking about, being the souls of their community. So helping restaurants support at-risk communities. This is flipping it around just a little bit and putting the restaurant more, I guess, in the driver's seat of doing this and funneling it towards specific programs. So this program, and I thought this was interesting. The first one was to help restaurants feed their communities. So they were writing about the fact that the restaurants around the nation have stepped up to feed local communities, and we definitely saw that locally here in San Francisco, Oakland, all the groups that stepped forward to keep the restaurants open and to function as essential workers and to feed, for example, first responders, you know, people working in hospitals. They were, you know, making meals for physicians and nurses at hospitals who were working, you know, multiple shifts, et cetera. So that was, you know, it was great. So they're saying to continue this important work, we support providing federal funding to programs accessible by states and localities, to partner with restaurants and nonprofits to prepare meals for vulnerable populations, including seniors and underprivileged children. So nobody, nobody wants to get on the wrong side of seniors and underprivileged children. We all want to support, but it would say that the nonprofits would be allowed to continue partnering with restaurants to prepare food for those at-risk communities. So I thought, okay, that makes sense. What they're talking about now is elevating it to a federally funded program. So that has not been the case. So that was one. And kind of dovetailing into this is the second part, increasing access to restaurant meals for low-income Americans. This one actually is talking about creating creating access to affordable food critical for low-income people. Okay, that's again all good. The issue would encourage Congress to, number one, create programs that authorize funding to states to contract with restaurants directly and provide nutrition benefits to low-income participants during the period of the pandemic. So that one has a kind of a start, a middle, and an end that it is for the duration of this pandemic. So that was number one. The second part was expanding the population of people eligible for benefits under the Restaurant Meals Program to ensure that SNAP, or Supplemental Nutrition Assistance Program, participants can access food at the local restaurant and make it easier for states and restaurants to participate. So number one is one way, number two is the second way, and number two actually has two parts to it. Take it away. What do you think?
Well, the first one about the federal program to provide meals, I think the most of the stuff that I've seen written is that the groups tried to do this through crowdfunding or other fundraising, and they would raise money and then use that money to pay the restaurants to prepare the meals. And the restaurant, they came up with a price so that it covered the cost of the food and the cost of the people to prepare it. So it was a benefit to both parties because they prepared all these meals for people who needed them, and it kept people employed at a restaurant because they could pay for the workers to be there and have a little bit of a profit on it, but it wasn't like at full price. So having a program to do that, I think is a really good idea, because I think they've kind of started to run out of people donating and crowdfunding and all. That takes a lot of time and work for people to do. And I think if they had a way of having a program that would help assist with that, that might be a better way to go. I think it's a good program. I think it probably is. This one didn't have an end to it, did it? This one was continue to partner with.
It was a continued partnership, yes.
Yeah. So I think this might be good if it's kind of controlled over the long term, so it doesn't kind of get out of control. But I think a lot of the restaurants really do look at the give back to the community in a really big way. And this would help facilitate that because it's something that they could count on to be supported. And so it wouldn't just be on them to try to do it or for other people to try to fundraise, that it would have a specific program. So I kind of like that one. The increased access to meals, the restaurants would have certain special items on their menu that would be healthy and be at an affordable price for people who couldn't afford a whole lot. I guess it would work sort of similar to the first program, except it would be more widespread. It wouldn't just be to first responders or that sort of thing. It would be to any low-income participant. I don't know. This, again, it depends on the restaurant and how much they want to give back and how much they want to commit their resources to doing this, because again, when a restaurant is there and operating fully, it becomes very difficult to find the time to do some of these programs. Right now, it's not too bad because they have a lot of downtime, right? And so you can fill in your downtime with doing the meals and having a lot more community outreach. It becomes more difficult, I think, when the restaurant is up and running full time, in that they have to sort of balance what the needs of the restaurant are against the community, and they have to figure out how to make that work. So I think these programs, while they're very good, the restaurants sort of have to see how it impacts their business and how much they can afford to do it before it starts to impact everything else that they do. I think having a state or a federal group involved, as long as they have the funding for it, and the states come up with it or the federal people come up with it, it's a way of getting meals into the hands of people who need it. So I don't have too much trouble with that. The SNAP program is a little different. When somebody comes in, they can go ahead and use their card and have their meal. The second one with the SNAP program, they didn't really say if it had to be a certain price point.
I think, you know what, I remember when you and I had like a little huddle about this pre this call. And one of the things we found is when we were doing a little digging is that the SNAP program actually already has a program that does this, and they want to expand it. So that was, they were looking at this as an opportunity to expand that program. And the way that it works right now is that the participating restaurant has to have a special meal item that is lower cost than anything else on the menu that is accessible for the person using the SNAP card. So they were able to use the SNAP card for that item, is the way that I read it. Excuse me. Right. Or at least that they had to have that one item, at least one item. And so it requires a restaurant would have to have a specific menu item on board at all times to meet the requirement, at least one item. So that was one issue. And I think the other thing, and I did have a question about this with regard to the feeding the communities one, which was number one. They were talking about partnering with restaurants and nonprofits to prepare meals for vulnerable populations, including seniors and underprivileged children, which again, great. But my question, economies of scale, a restaurant buys its food at cost. I mean, they have suppliers that they go to, and it costs what it costs. Somebody that's running a food bank or Meals on Wheels, et cetera, who's preparing food for seniors is getting a federally subsidized and or discounted access to food products to make those meals. They're a nonprofit, so they're not taxed the same way that a restaurant, which is for-profit, is. And so everything that they handle, from their facility to their workforce to their kitchen to their supplies, are at different rates, different tax consequences. And I wasn't sure how, like if you start saying, okay, now we're going to go into a restaurant and do this, does that mean that the restaurant now has access to those same special subsidized food sources, or they have to do it from their own food source, which is at much higher cost? I mean, it's way higher cost. I mean, it's less than what you and I pay for something when we go to the grocery store, but it still has an economy of scale available to it that is not available normally to a restaurant at that point. And then what does it do for your local nonprofit network, which has been fulfilling this role in most cases, and not everywhere, but in most cases, pretty darn well for a really long period of time. They've kind of got it down. They have their funding sources and their relationships, and they can deliver, and they've got their workforce and their volunteers. And all of a sudden you throw restaurants into the middle of that, and you've got competition almost, and unequal access to supplies, delivery, et cetera. So do you see any issue with that maybe moving forward?
I think that while the nonprofits were doing a lot of the distribution of food, and it would be the things like the various kitchens and where people can go and have meals that you're talking about, where they can go in and have their meal. in a specific location. I think part of the problem during the pandemic was, again, people being able to have access to that kind of facility, and restaurants could fill that kind of need when you didn't have the soup kitchens or the facilities that the nonprofits would normally operate, because a lot of people didn't, they sort of initially didn't do some of the stuff that they did before. So the restaurant sort of stepped in to try to help out in the interim. As far as the pricing goes, or the food sourcing goes, I don't know how some of the nonprofits did their work before, whether they had people that donated stuff. I know a lot of times you see restaurants donating food that they can't use or that's getting ready to expire. They'll give it to the various nonprofits so that they can either use it for meals or distribute it to people who need it. So I think if the funding is there and they can work on their pricing with some of the vendors to kind of help with the cost, I think it should be okay. I just see it as more of an expanding program. It just gives the nonprofits another resource other than them trying to get their volunteers in there to work on it. They have people who do this for a living, and they can produce, 500 meals for them to pick up and move out without a whole lot of problem, because that's kind of what they do. So it's rather efficient, plus it puts a whole nother group of people at work. And I know in New Orleans, they had a big program like this, and a lot of the restaurants said if it wasn't for that program, they wouldn't have been able to survive in between, because they knew they could count on having to produce X number of meals a couple of times a week for the groups to distribute. And so that really helped them keep the employees working when they didn't have the business to do it otherwise. So I think it was kind of works hand in hand. It helps nonprofits, and it helps the restaurants, and it helps the community with people who are really kind of hurting right now. And I know here, even the food banks and everything, you had lines of cars of people, especially when they were first laid off. They had lines of people every day at the food banks picking up packages of food and stuff like that, because they had all of a sudden, they don't have a lot of savings, and now they're both wage earners are out of work, and they needed something rather quickly. So I think this is a good way in a situation like this to really kind of help people at least get meals that are good for them and that are healthy, as opposed to kind of letting them try to get what they can get. That's a tough thing to deal with.
I guess it makes sense if they're, like if they're between 25 and 50% indoor dining, sit down occupancy, being able to pump out a certain number of meals per day would allow you to beef up your kitchen staff. So you may not be making them for on-site indoor dining consumption, but you're at least making it so that somebody, like you said, has the value of the nutritional excellence and supports the local restaurants. So hopefully that'll work out. But it's just everything again. It's like the way that I read it. It sounds like it'll be a program that doesn't go away. It's not limited to the pandemic. So that was one of the things. And again, that may be a good thing or a bad thing, but it just adds more layers to restaurant. And I was like, oh my gosh, if they're going to have to show, like what they did and how they gave it, that it's one hand gives and the other hand always takes away. And that's the thing that I worry about is complexity, meaning a restaurant wants to do the right thing and wants to utilize its, its facility for the best. And then the requirements to do these things are so convoluted and onerous and take turns and have clawbacks and things like that moving forward. And it's just like, okay, so do you really want to get involved in something like this? I mean, it's never as good or as easy as it ever seems when you first read it. I guess it makes me.
And that's one of the dangers you could run into. You know, it's kind of like the payroll tax thing. You know, you don't want people to get used to something and then all of a sudden it stops, you know, and then it creates even more havoc, you know, when it stops, or the expectation is there that it's always going to be there, and it may not always be there. So yeah, I think some of these programs are good during the pandemic. I'm not sure how good they'll be afterwards. And again, it depends on the, you know, the restaurant, like especially with the SNAP program, that's something that the restaurant has to sign up for. So they have to decide whether that's something that's workable for them. And, you know, one of the things to consider, and it sounds kind of awful, I guess, is if people can come in and use their SNAP card and you can only seat 25 or 50%, is one of your tables going to be caught with people who are limited with what they can buy,
Yep.
as opposed to people who come in and order from your regular menu? Or do you only offer it at certain times of the day? You know, maybe at the off times, like before it gets busy, early bird type thing or a lunch thing, as opposed to during the main meal time. So again, I think that's some of the things that the restaurants have to take into account is, you know, how is it going to impact my business if I do it? And is it something that I think I can manage? Or is there a different way for me to give back to the community other than in this kind of a program? So I think, again, that the restaurants just need to, it's a nice idea, and it would be up to the restaurants to really decide if they can fit it into their model of how they need to work.
Right. I guess one of the issues would be that whole revenue per seat and you know, square footage revenue being generated at any given time. And if you're already cutting that down to 25%, that seat has to work really, really hard, and it has to be at top dollar. I mean, it has to be at top dollar just because you're already under 75%. So anyhow, Brenda, this has been long-winded. And I wanted to find out if you had any sort of parting thoughts that wrapped up the entire the whole thing. And I just, as a sort of a parting thing, I probably will break this into two because it's really long. But as I edit it in, do you have any specific thoughts about any one of these items, or of it as a whole in its entirety?
It's not the legislation so much as it's a proposal. And the devil's always in the details, right? So if they pick and choose what sort of things come through and do get passed into law, then, you know, they can change in the process between what starts here and what actually ends up. I think a lot of this, I heard that a lot of the restaurants in New York were really, really getting actively involved, and some of the bigger restaurants getting actively involved with going to the government and trying to get something like this to happen. I do know there in California, the CRA, the California Restaurant Association, has pushed relentlessly with Newsom, and from what I understand, there is no coming back to them, any kind of receptivity to trying to address the issues. They say they're going to keep working at it, and they're going to keep at it, but they did not address anywhere near the amount of issues that are facing the restaurant industry in California. And when they asked them to come back for a special session specifically to address it, it was not received very well. So, you know, I think it's going to, if it doesn't happen at a national level, I think it will happen at a state level, because every state has the same problem. It would make more sense if there was a national program, because there are so many different kinds of restaurants involved and everybody's affected. I mean, I don't know of any restaurant that says, oh, I haven't been affected by this at all. So I think it makes sense to have a national program. I think this is a big wish list. I don't think, they'll accept all of it. I think they will pick and choose the things that will work. It may be that they do some at one time and some at another time, kind of seeing how the programs work. But I think it's really great that the National Association backed it up, and I know a lot of the like I said, some of the big names in the restaurants have really supported it as well. So I'm really happy to see they got some national attention to the program, as opposed to trying to let the poor, individual restaurants at a state level try to get anybody's attention.
Just as a final thought, if you were in charge of all of this, what would be the top thing that you would do if you could like wave your magic wand? What would be the top thing you could do that would make an actual difference for especially the small independent business restaurant now?
Out of the proposal that they have here, the one that I like the most is the long-term program, because that addresses the need for the infrastructure for the business. So I think the infrastructure of the business has to be addressed first. In order to make any restaurant successful, it has to be able to function the right way as a restaurant. And in a lot of cases, that has to change, and that's going to be costly. And I think having a way of having the restaurants either move or renovate and get themselves to the level of protection that they need in the restaurant is key to then having people feel comfortable coming into the restaurant, and that will generate the sales, and you can bring your staff all back. You've got to start, and you can't start in the middle. You have to start at what is going to be the main thing you have to work with. And that is, how does a restaurant look? How is it going to feel? How are you going to vision your restaurant going forward? And I don't know of any restaurant that won't have to change, unless they just opened, like in the last few months, But anybody who's been in business before, I think something has to change in their restaurants, because they just can't function the way that they were designed to function. And that also affects your rent structure and everything else. So I think that whole infrastructure thing has to be addressed. And I think these long-term programs make a whole lot more sense. And if there is some sort of built-in forgiveness over a period of time, that they take the loan, they do what they're supposed to do with it, business progresses, and you stay in business another 12 months or whatever it is, and a certain percentage gets forgiven, and then another 12 months, another percentage gets, so you can stay in business long enough to get it paid off without you having to pay it back. So that to me would be the first place that I would start.